Imagine the human mind as a grand, almost mystical treasure hunt, vast and brimming with undiscovered riches. For years, therapists have been like well-intentioned treasure hunters armed with trusty but basic metal detectors. These tools do a bang-up job finding coins and trinkets just below the surface. No complaints there. But what if there were deeper treasures, buried vaults and caverns of emotional gold that our trusty metal detectors just couldn't reach? What if I told you that there's an Indiana Jones of the inner world, a person who didn't just upgrade the metal detector, but brought in satellite imagery, sonar, and a full excavation crew? Get ready to swap your clinical spades for industrial-grade excavators as we delve into the groundbreaking, literally and metaphorically, work of Dr. Jeffrey Young. He's the therapist who looked at the rulebook, grinned and said, "Let's rewrite this baby." Young is not your run-of-the-mill psychology fanboy. Nope, this guy's sipping knowledge from the Ivy League goblet. He does his undergrad at Yale, the Hogwarts of higher education. Then, he catapults himself to the University of Pennsylvania for even more alphabet soup after his name. And oh boy, does he hit the academic jackpot. He bags the ultimate mentorship role, studying under none other than the Dumbledore of cognitive therapy, Dr. Aaron Beck. That's like learning to paint from Picasso or cooking from Gordon Ramsay, only less yelling, we hope. But hold your horses. Young isn't just nodding along and taking notes. He's got questions, people. It's dawning on him that they're basically doing emotional landscaping, snipping away at the leaves but never digging out the roots. It's like slapping on some deodorant when what you really need is a full-on soap and scrub shower. Young starts to think, hey, this symptom whacking isn't cutting it. He gets that itch, the one that says it's time to revolutionize this bad boy. And so, our daring intellectual renegade rolls up his sleeves and decides to take therapy from emotional gardening to full-on emotional excavation. Get ready, psychology world, here comes the bulldozer. Dr. Young isn't just throwing random ingredients into his blender. He's crafting a Michelin star-worthy therapy smoothie known as Schema Therapy. But this isn't a one-size-fits-all mocktail, oh no. It's a therapy that's shown remarkable effectiveness in treating an array of complex conditions: borderline personality disorder, chronic depression, anxiety, and even eating disorders. For those issues that typically have therapists running for the hills, Schema Therapy rolls up its sleeves and says, "Challenge accepted." What really sets Schema Therapy apart, though, is its ability to sustain these results long-term. While many therapy models using cookie-cutter techniques offer the psychological equivalent of a Band-Aid, Schema Therapy aims for deep-rooted healing. It's like going from merely patching up potholes to completely repaving the highway of your mind. Studies have shown that the gains made in Schema Therapy are not only significant but enduring, reducing the cycle of relapse and making real-life practical differences for patients. We're talking about a method that doesn't just work for the day's emotional turbulence but acts as a long-lasting vaccine against recurring psychological hiccups. Trust me, this is the Rolls-Royce of psychotherapy, providing both the luxury of immediate relief and the longevity of deep foundational change. Young has this cocktail of cutting-edge therapy, and you'd think he'd be hailed as the Elon Musk of psychotherapy, right? Wrong. The established cognitive therapy circles looked at him like he'd just suggested the Earth was flat. We're talking academic shade, professional cold shoulders, and probably some passive-aggressive sticky notes on his office door. But Young is as unshakable as a cat on a hot tin roof because he has something that's bulletproof: data. He's packing randomized controlled trials, long-term follow-up studies, and all the statistical muscle you could want. One standout finding: Schema Therapy. Not only thrives where other therapies struggle, it delivers a sledgehammer to recidivism rates among treatment-resistant patients. We're talking about those chronic cases, people who have been in and out of therapy, like it's a revolving door, finally finding a home in Schema Therapy. And it's not just Young beating this drum. Independent research teams worldwide have thrown their weight behind Schema Therapy, substantiating its effectiveness for those knotty, intricate cases that give even seasoned therapists night sweats. So while he started as a lone voice in the wilderness, Young now stands at the helm of an evidence-backed revolution. So how about that, doubters? Your move? Young didn't just start a fire. He ignited a whole blaze, one that's spreading across continents. With the International Society of Schema Therapy, He's invited the brightest minds in therapy to pick up his torch and run with it, sometimes sprinting, sometimes stumbling, but always pushing forward. And here's the kicker. They're not just nodding politely at the old ways. Nope, these audacious therapists are scrutinizing, analyzing, and boldly going where no therapists have gone before. Like Jung, they're not afraid to challenge the status quo, to toss out the old bathwater and innovate, all to help their clients. Not just the easy cases, mind you, but the ones that leave most therapists scratching their heads and flipping through textbooks. Research in Schema Therapy isn't just some dusty shelf of papers you might stumble upon in a forgotten library corner. Oh no, it's vibrant, it's thriving, and it's an active global initiative. There are new studies every year that refine the model, tailor its effectiveness, and confirm what Jung already knew. This is a game changer for psychotherapy. So here's your call to action, therapy pioneers. Ready to join this vanguard of mind healers? Yearning to elevate your practice? Well, pull up a chair at the Schema Therapy Training Center of New York, where the founder and director, Travis Atkinson, will give you the tools to be a part of this global revolution. If this message resonates with you, if you feel that little spark of curiosity flicker into flame, then subscribe to our channel, hit that like button, and get involved. Let's not merely challenge the norms, let's redefine them, patient by patient, study by study. Until we meet again, know that each of you has the power to be a changemaker in mental health. Onward to more healing. Cheers. Brought to you by the Schema Therapy Training Center of New York. Join us.